right, today we're doing something a little different. We're not just going to list facts about a disease. Instead, we're going to follow the story, the entire journey of an infection. We're tracing the path of dengue fever, right from a single mosquito bite all the way to this complex and sometimes really deadly battle that wages inside the human body. So here's how we're going to break it down. Think of it as a 5-act story. We'll start with the bite itself. Then we dive inside the body to see how the infection really gets going. We'll hit that critical turning point, when dengue can get really dangerous. Then we'll look at how doctors fight back, and we'll finish up with this fascinating and honestly kind of scary twist about what happens if you get it more than once.
Okay, so every good story needs its main characters, right? And in the story of dengue, we kick things off with a villain and its secret weapon, a super adapted mosquito, and the tiny virus that it carries.
So let's meet our main antagonist, the Aedes aegypti mosquito. Now, you've probably heard of it as the tiger mosquito, and yeah, that's because of its black and white stripes. And look, this isn't just any old mosquito. It's the specific courier, the delivery service that brings the dengue virus right to our doorstep, or well, our skin. And what's really wild is just how perfectly this mosquito has adapted to live with us. I mean, it's a day biter, so it's active when we are. It doesn't need a big swamp to lay its eggs. Nope. It thrives in those little pockets of clean, standing water that we leave all around our homes. In water coolers, flower pots, maybe an old bucket you forgot about in the backyard. And then there's the other main character, the dengue virus itself. Now, it belongs to a family called flaviviruses. But here's the absolute most important thing you need to get right now. Dengue isn't just one virus. There are actually 4 different types, what we call serotypes. Seriously, burn that number, 4, into your brain, because it's going to be a huge deal later in our story. Okay, so the mosquito has made its move. The virus is in. What happens next? Let's follow it inside the human body and see what it gets up to. So right after the bite, nothing happens. It's quiet. For about 4 to 10 days, the virus is just multiplying like crazy inside your body, but you feel totally fine. This is the incubation period. It's literally the quiet before the storm. And then, bam, the storm hits. The first signs are what people have called breakbone fever for a long, long time. And trust me, it's for a very good reason. It kicks off with a sudden high fever, a splitting headache, and this just intense pain deep in your muscles and joints. It is an absolutely miserable experience. Now, for most people who get dengue, the story pretty much ends there. A terrible week or so, and then they recover. But for a small percentage, the plot takes a really dramatic and dangerous turn. This is that critical point where dengue can go from being a severe flu-like illness to a full-blown, life-threatening emergency. So you have to wonder, right? What's the trigger? What is that key difference that separates a standard, miserable case of dengue from one that can actually kill you? And this really shows that big divide. On one hand, you've got classic dengue fever, high fever, aches, it's awful, but it usually resolves on its own. But on the other side, you have dengue hemorrhagic fever, or DHF. And the one single thing that defines DHF and makes it so incredibly dangerous is something called plasma leakage. So, what on earth is plasma leakage? Well, think of your blood vessels like a garden hose. In a healthy person, the water stays inside. But in DHF, that hose starts to get tiny little holes in it. It becomes leaky, and the watery part of your blood, the plasma, starts seeping out into your body's tissues. This makes the blood that's left inside the hose, well, it gets thicker, more concentrated, and that condition has a name, hemoconcentration. And this is something doctors can actually measure. They look at something called the hematocrit, which is basically just the percentage of your blood made up of red blood cells. If that number suddenly jumps up by more than 20%, whoa, that is a huge red flag. It's a clear, quantifiable signal that plasma is leaking out and that the patient is in serious danger. And at the exact same time, the body is fighting a war on 2 fronts. First, the virus itself attacks the bone marrow, which is like the factory where you make new platelets. And second, your own immune system, trying to fight the virus, can accidentally start destroying the platelets you already have. So it's this double whammy that causes a massive drop in these little cells that help your blood clot. The medical term for that is thrombocytopenia. And yep, you guessed it, there's a specific number doctors are looking for here too. A healthy person usually has somewhere between 150,000 and 450,000 platelets. If that number drops below 100,000, that's the second key lab finding for DHF. So let's put it all together. Thick blood and a low platelet count. Those are the two big warning signs for severe dengue. So what happens when too much of that plasma leaks out? Well, the total amount of blood circulating through your body plummets. It drops to a dangerously low level. Your heart just can't pump enough blood to keep your vital organs going. This is what's called hypovolemic shock. And this is the number one reason people die from severe dengue. It is an absolute medical emergency.
Okay, so now that we get the danger, let's switch gears and talk about the defense. How do doctors on the front line spot this happening? And what in the world can they do to stop it?
When it comes to diagnosis, timing is absolutely everything. For the first 5 days or so of the fever, doctors can actually detect the virus itself. They use tests like RT-PCR or a faster one called the NS1 antigen test. But after day 5, the virus kind of goes into hiding. It gets much harder to find. But by then, your body has started making antibodies to fight it, and those can be picked up with a different test called an IgM test.
You know, there's also a surprisingly simple, low-tech test doctors can do right at the bedside. It's called the tourniquet test. They just inflate a blood pressure cuff on your arm and leave it there for about 5 minutes. If your smallest blood vessels, your capillaries, are fragile and leaky, these tiny little red spots called petechia will pop up on your skin. If they count more than 20 of those spots, it's a positive test. It's a pretty good sign of that capillary fragility that we see in DHF.
So let's say the diagnosis is confirmed. What's the cure? What's the magic pill? Okay, this might be the single most important thing to understand from this entire explainer. There isn't one. There is no specific antiviral drug for dengue. You can't just kill the virus directly. The entire treatment strategy boils down to one thing: supportive care. So the playbook for treatment is really a list of do's and don'ts. The absolute number one do is to manage that plasma leakage. That means IV fluids, and lots of them, to keep the blood volume up and prevent the patient from going into shock. For the fever and pain, paracetamol is the way to go. But the critical don't is avoiding drugs like ibuprofen, what are called NSAIDs. Why? Because they can mess with the already low platelet count and actually increase the risk of bleeding. So that's a huge no-no.
All right, our journey is almost over, but there's one last twist in the tale. And it's a really counterintuitive one. Remember way back at the beginning when I told you to remember that there are 4 different types of the virus? Well, this is where that becomes incredibly important, because it creates a really dangerous paradox.
Okay, check this out. Let's say you get dengue, serotype 1. Your body fights it off, creates antibodies, and now you're immune to type 1 for the rest of your life. Great. But what happens if, down the road, you get bitten by another mosquito, but this one's carrying type 2? You'd think those old antibodies would help, right? Wrong. In a cruel twist, they can actually make things worse. This is a phenomenon called antibody-dependent enhancement, or ADE. Those old antibodies from the first infection, they grab onto the new virus, but they can't kill it. Instead, they accidentally act like a Trojan horse, helping the new virus get inside your immune cells way more easily. And the result? A much, much more severe infection the second time around. And that leaves us with a really tough question to chew on. As things like climate change and global travel help this tiger mosquito expand its territory, more and more of us are going to be exposed. So, the big question is, how do we fight a virus that has literally evolved a way to turn our own immune system, our body's greatest defense, into a weapon against us?